Started here. I just wanted to thank everyone so much for coming today. My name is Tammy Commander, and I'm the training grant administrator for this ARPA 1.05. And Heather Johnson, if you want to introduce yourself.
Sure, Heather Johnson. I have an awesome title, ARPA Long-Term Direct Care Workforce Unit Supervisor. I say it really fast so I can get it all out. And I work with this awesome team here. We are working on actually 8 workforce-related ARPA projects, one of them being this grant. And we do kind of roll as a team and try to support each other. And so I will pass it over to Brooke. And you can also plug the collab, Brooke.
I'll do that. Yeah. So I'm Brooke Snyder, Workforce Sustainability Specialist. And my main job here, other than running the slides, is our Direct Care Workforce Collaborative. If that's not something you've heard of, it is our quarterly stakeholder-led meeting where we come together and try to find ways to support our direct care workforce. From that meeting, we have 3 action groups that meet bi-monthly. So if you're interested in learning more about that, just put your name in the chat and I will put you on our little email newsletter and get you a little bit of information about our.
Brooke froze.
I froze. I apologize.
Sam, do you want to go?
Sure. Hello, everybody. My name is Sam Hall, and I am the Career Pathways Specialist on this lovely team. And I work on one of the ARPA projects that Heather said, as our team is responsible for 8 of them. I will pass it over to John.
Thanks, Sam. Hello, everyone. My name is John Hendricks. I am the Direct Care Workforce Support Specialist. What that means is that I am working on ARPA 1.04, which is the Resource and Job Hub, which will connect providers like yourself to workers and have training modules and all that kind of good stuff on there. And I will give it over to Jennifer.
Thank you, John. I'm Jennifer. I am the Direct Care Workforce Data Infrastructure Specialist on this team. I'm working on a couple of the ARPA projects, mainly Initiative 1.02, which consists of a couple surveys, and as well as Initiative 1.09, which is a workforce compensation research project. It's great to see you all here. I'll pass it back to Tammy.
Thank you. Brooke, can you pass to the next slide, please?
Perfect. Can you all hear me now?
Yes.
Perfect. So I'll just go over this really quickly. We are recording. You probably got the alert. Use the chat. As you can see, most of our team is here, so we will be able to monitor the chat for any questions you might have. But also, as Tammy's going through this, feel free to raise your hand to ask a question in real time, and we'll be sure to get your question answered before we move on to the next topic. Meeting materials will be posted to the ARPA grant website. Hopefully soon. So that'll include a frequently asked question as well as the recording from this. I don't see anyone listening by phone, but if you are calling in, *6 to unmute yourself to speak and *9 to raise your hand. We should be providing live transcript. You should have the option to set that up at the bottom of your screen as part of your settings. And then more information about the Direct Care Workforce Collaborative website can be found. I think Heather dropped that link in the chat. So back to you, Tammy.
Wonderful. Thanks, Brooke. Can you go to the next slide, please? Well, we're very excited to be providing this grant for all the direct care workforce and the providers that are here today. So the purpose of the grant is to provide opportunities for direct care workforce workers to gain higher level skills for better retention, for better, what was it? It's upskilling. Is it upskilling, Heather? That's what it is, right? Just to gain better skills so that employees feel valued and able to know that there's opportunities to grow within your company. So that's what the purpose of the training grant is for. This grant is specific for all HCBS workforce providers. And the grant is designed to supplement, not supplant training. So that is the main purpose of the grant. Next slide, please. So we just talked about the eligible applicants. So you have to be an HCBS waiver provider, but we just are introducing that this training will be, the training fund will be available for certified nurse aides and home health aides as well. So you don't necessarily have to be an HCBS provider, but you must be a Health First Colorado provider. And then for anyone who is applying for the grant, who is a training vendor or a provider, you have to have the training that's developed specialized for the HCBS workforce. If you have any questions about, being an HCBS provider or anything like that, please put it in the chat and we'll address that. Next slide, please, Brooke. So there's a list of some eligible expenses. I hope that everyone had received the RFA as far as gaining the information. The RFA is a request for application. So that kind of gives you the outline and the parameters of the grant. And so if you haven't already received that, then please put it into the chat and Heather will put the RFA for you. And then, yeah, we just want all, as much information about the training as possible. So if you're filling out the grant application, then please provide links to the training, how much the training costs, and the training material, and then also the indirect costs. So that is going to be a part of the budget worksheet. That is also a part of the application. I'm sure there's going to be some questions about that. So if you want to wait till the end, we will definitely answer the questions specific to the budget worksheet. Anything else with this, Heather? No, right? No. Okay, great. Next slide, please. So we're really, really, really excited to offer more than one grant. I'm sorry, can you just go to the next slide, Brooke? I'm just going to show everyone yes. So we have 6 different grant cycles. So if you're here and you are applying for the first grant cycle, then the award announcement day will be December 15th. So after the completion of the whole grant cycle, and you've already been awarded and you've received your reimbursement, then you are eligible to apply for another grant for another training at a different time. So that's really it's a really great opportunity for everyone to use the funds for multiple trainings. Next slide, please. All of the information for the application can be found on the ARPA Grant Opportunities website. There are many, many, many different ARPA grant opportunities. So if you're not familiar with the website, so please check it out. Please bookmark it, and as well as the direct care workforce site as well. We're doing a lot of really great, important work from the state to support the direct care workforce, and offering these grant opportunities is a great opportunity for us to provide that for you. So these are the things that are all required as part of the application. Once you submit it, you'll receive an email stating that we have received your email and your application, and it is complete and we're ready to review it. And then if you go back and you look at the grant cycles, which is again on the Grant Opportunities website, you'll know when you will be notified if you've been approved for the grants. Next slide, please. So that was just a brief overview because I wanted to leave a lot of time for different questions. And, for those of you who are actually here in attendance, I want to give you the opportunity to ask as many questions as possible. You have a panel of experts here for you. So I will open up the chat to any questions. You can always email us if you think of a question later on, and you can always email the direct care workforce email, and any one of us will be able to answer. So I'll just go ahead and open up for questions.
Is it a leak? Am I saying that correctly?
Close.
Alec?
It's Alec.
Alec.
That's right.
Okay.
Hey guys, this looks like a really great grant. I just have a few questions just to make sure I understand it correctly. Just by way of a background, I'm a partner at Alpine Home Care. We're a non-medical home care agency here in Metro Denver with about just under 400 caregivers working for us. And so we were brainstorming a little bit about this grant. And if it's okay, I would just run a few of these ideas by you, and then you can say, hey, that's not what we're really thinking when we think about this grant, or yeah, this could fit. Mainly, I guess my confusion, if I want to call it that, centers around this higher skills kind of stuff. So we currently don't really have a dedicated trainer. And one of the ideas that we had was to hire a dedicated trainer to do sort of the caregiving training as part of the onboarding for us. Is that sort of one of the intentions under this grant, or does it have to be, more specific or more skilled than the general training? That would be my first question.
So this training, it would not cover the required trainings that you would provide your staff as they onboard, or that like annual or biannual, triennial recertification they need for their job. This would not cover that. We do have another ARPA project which would cover the standardized core curriculum, which should roll out February 2024, April 2024. We are building that. This is where that supplement versus supplant falls in with this with this grant. So when we're thinking of trainings, and we did Tammy and I toyed with like, well, we should tell them what they could do. And I'm like, we don't want to put in constraints. We really appreciate creative thinking. I think of it as, so I have staff, I'm working with folks in their homes, and they're dealing with loss of loved ones, right? And there's that grief process and stuff that goes on, and like, how can I support my staff in understanding how to do that? So looking for those trainings, that's just an example of something that would be available. Either it's something you can locate a provider to do, or you can sign up for a resource for that would, so we're looking at being able to give individuals skills within that. They're already an employee, they're already trained, but what other skills can they have to do more, to do different, to do better? That's kind of how we're looking at it.
Okay, I understand. And in the same vein, training for the CEUs, continuous education credits, that those are also excluded as far as this grant is concerned.
So I would probably have to take it back to the team and discuss a little bit further. The way I had originally looked at it is, if by the nature of you taking this training that you learn higher level skills and you get CEUs, that's a benefit,
Okay.
right?
Right.
If you tell me, hey, I need this so I can have CEUs so I can maintain my certification, no, because that would be supplanting, not supplementing.
Okay. Great. No,
I
thank you
just
very
want
much.
to add,
Yeah.
I just want to add, Alec, that as far as the CEUs goes, it's really the training fund. This particular ARPA grant is really to help the direct care workforce, right? So the people who are directly in contact with the clients, and not necessarily, because somebody who needs CEUs, they're already a higher level, right? Like if they're required to have CEUs, then that means that they are not necessarily like a direct care workforce person. Did I lose him?
No, that's not true. I mean, all our caregivers are required to complete, I think, 6 CEUs per year as continuing education. But do think it kind of depends on what kind of topics we want to put in. But no, thank you. That is very helpful.
Yeah, and if you have questions about specific topics or specific trainings, then please email us and we'll be able to give you, you know, a more direct answer.
Thank you. Appreciate it.
Thank you.
Nick, I saw your hand up. Did you put it down or do you still have a question?
I had a question, but I think you all answered it, and that's just confirming. So this grant funding would have to be used for staff who are in direct client with our client or direct contact with our clients, correct? It couldn't be somebody who has kind of like a, not direct contact, but has an impact on our clients still. Like I'm thinking we have some client services staff who talk to our clients every day. We have nutrition services staff who talk to our clients every day, but then we have kitchen staff who aren't engaging with our clients, but they are preparing meals for our clients, and education might be helpful there. So just clarifying, like that's really geared towards direct service staff.
So I think it depends on how you're able to say this is how this helps, right? So it is HCBS Providers, and we wouldn't be looking to send like a CFO of a company to a training, right? Like that's not what we're looking for, but we would be looking for what helps people provide the best services possible to the members.
Okay.
And how will they grow? And I think of like, if somebody is working in nutrition services, you know, what do they need to know about that person or that group of folks that would make it more meaningful for them, more effective, anything like that. And then is there any other way for folks that maybe have one role to branch out and be available to work in other roles? I know while this isn't facility based, but especially during COVID time, like a lot of facility based folks were looking at ways that they could have their staff that work in maybe certain areas actually start doing more online, you know, direct care stuff. And so like, if there are ways where you're saying, hey, like the staff does this, but I'd really love to elevate them for this, because then they can do X, Y, and Z, like that makes, that's what we're looking for. It's really hard because we can't just say, you know, we can't tell everybody what to do and really approve it. But so trying to provide some broad ideas, but if that helps provoke some thinking of how this would actually, how it could actually benefit the staff and the members served, that's our ultimate goal.
So if you do have specific trainings that, you know, maybe is a little bit more creative or, you know, a little bit outside of the box, then please email us and, you know, let us know what the training is, what you would like, what the intention of the training is, and, you know, where you would like the training to lead your direct care workforce staff members. Does that make sense? So please email us, and then either Heather or I or someone on the team will be able to respond.
Okay, yeah, that makes a lot of sense, and that's really helpful. So it's essentially just how can these dollars be used to improve like the services that our clients are getting, and that's through training. Okay, and that may or may not be with direct care staff who are currently in a direct care role.
Yes.
Okay, that actually is really helpful. Thank you so much.
And then I think somebody put in the chat that from the Project Angel Heart, I just wanted to say that I did look up your provider eligibility and you were listed as a HCBS provider. So I just wanted to have that clarified.
Thank you for checking on that. Yeah, I just found it as well. I must have typed it in wrong when I first was searching, but yeah, thank you very much.
You're welcome.
So I will go through some in the chat, and I did respond. If you apply for a grant during one window and you don't get it, or it's maybe partially awarded, right? Because maybe some things were not allowable, you can apply for them. The only rule with that is you have to complete one grant before another one is awarded. So you might, if you didn't get the grant for whatever reason, by all means apply for the next one, right? But let's say you got a partial grant because this portion worked. You need to complete that grant cycle before that would need to be closed out before you applied for the other one. There's another one, higher level skills. I know that's very general. I'm trying to think of some examples.
Like trauma? Like trauma-informed care? maybe?
Trauma-informed care, maybe somebody has a new diagnosis that you're working with and you need some more training to figure out how to make that more successful for everybody involved. Sometimes we offer a lot of the standard training is real basic, and then maybe there's some like I think of the in terms of like schooling, right? You have your 101s, your 201s. Like if there is some stuff that takes the base knowledge and builds off of that for a higher level skill, that's great.
Or like specific to a diagnosis, right? So if one of your clients comes and they have a new diagnosis of diabetes and they just would like some support and help in, how to incorporate this new diagnosis into their lives, and that's a service that you provide as far as like home health or something like that, then that would I think that I would consider that like a higher level skill because it's very specific. Does that make sense?
And then Allie's question. So I guess the part with hiring a person is what would you do when the funding is done? So would you, if you've looked at the application, we tried to make the application as simple as possible. And we know that what's simple to us doesn't really mean that's simple to other folks. It doesn't exclude wages for a person. I think the plan around that would need to make sense for like, what is the value add that they're doing? Like they're creating X, Y, and Z trainings. And then what is the plan when the funding is done for that to continue? I would look at that a little bit more and like look at kind of the questions and see how that makes sense to you.
Are there any other questions? Was there anything in the chat that I missed? I haven't been monitoring the chat, sorry.
Nope, I think we touched it all. We know that questions come up. Please feel free to email and I will drop our workforce email in the chat. We do have to kind of make sure that we are really fully thinking about the answers to questions before. So we do ask for a little bit of time for us to update the FAQ and put it back out. We should have, hopefully by today or tomorrow, posted on the website a frequently asked questions from what we've already received from our solicitations of just people asking about it and us asking for their questions. So we will get that updated. Also within that FAQ, it'll talk about ineligible expenses, because I know when it says training and training costs, you're like, well, what does that mean? You can get really creative with that if you want. And so there will be some parameters in there that kind of maybe help you understand what we can't fund with the grant. And it doesn't mean that those couldn't be part of what you're planning. It just means that it would not be paid for out of this. You'd have to have that alternate source, like maybe that's something the agency is going to pay for, or there's another way to make that work. You can certainly mention that if it makes sense to connect all the pieces that way. But we will get that out, and we are tracking everything on this. So what we'll do is we'll just send an email out to folks saying, hey, check out the FAQs on the website. And in the future, anytime people have questions, we'll send them like, hey, it's updated, it's on this site. We are doing another info webinar in November. We'll probably be doing them probably every month, and we'll get those out there. Also, our goal is hopefully after our first round of awards that maybe we have some folks who are successful in getting grants who maybe are willing to help other agencies think through some stuff, or, kind of be a grant buddy. We would love if that is ever an interest that folks have, and we'll ask folks as well. There is no match requirement or need. I was just going to get to reporting. So we have a fiscal intermediary that will be handling the invoices and payments. So on our end, there's a pre and a post grant survey that you would have to agree to doing, and there is monthly reporting requirements, and we have a monthly reporting form that we will send out via Smartsheet that the updates will. That's where you'll put your updates to all those questions and what's going on, and the fiscal intermediary is where your invoices will go, and they're the ones that will be paying out those invoices at least monthly. We understand that maybe that might not be what is working for your grants, but just so you know that it would be at least monthly for the reimbursements for those expenses. And there will be some grant paperwork from the fiscal intermediary. Like, so basically next steps are, once you get awarded, you will know on that day and you will know what next steps are. And then there'll be some paperwork aspects to have. And then the monthly reporting is something that Tammy will be sending out to you, and you'll complete via Smartsheet.
Mhm.
Wages are considered. Yes. So in that training, if that wage, it's an eligible expense.
It is eligible or easy?
It is. Wages are, I'll just run through some that are not. Capital equipment, food and beverages, fundraising, gift cards, politically related activities, promotional items, because we can't promote Medicaid, ceremony related items, software purchases, travel, lodging. There are some more, but that's kind of an idea of what's not, what would be excluded. And there could be things that aren't inclusive of the list, but wages are definitely something that would be factored in, or could be asked for, as long as it's tied in specifically with the training.
Right. Like, for example, if you had someone coming in, a specific trainer coming in to do the training with multiple members of your staff, then you should include the cost of the trainer, if that makes sense. Anything else? Did I miss anything in the chat?
Let's see. Curious, the decision to award grant is weighted on how creative requests are. So we have about $9.5 million in this fund. This is one of the grants coming out of it. There is another grant that we'll be pushing out that'll be part of this. I mean, I like creativity, but there's nothing on the application that's going to get you more points because it's creative. It just, I mean, I think you can do the most mundane thing, but if it makes sense, it makes sense. I would say I feel very comfortable saying, if we got down to what we're really going to look at is, as we get the applications, where are they at and who is not applying? And that's where that outreach is going to go. If we've got the I-25 corridor, but we don't have people on the four corners of our state, when we're looking at decisions at that point, we're going to try to pick smaller providers that are in this region versus that region, because we really want to get this to everybody in the state who can apply for it. So like those would be factors that come in, but when we score them, I'll personally reach out and give you a creativity point for that. But we've had a few applications come in, and we've seen some ideas where we're like, wow, I didn't even think that was a thing. So if you've already applied, congratulations, you've already hit the creative idea. So we're really excited for folks to see what will work. I mean, I get in trouble when I say this, but if you can live with no, you should ask. I mean, this is kind of a once in a lifetime opportunity we have with this funding to be able to do these things. That goes with a lot of our all these grants and a lot of our workforce initiatives. We understand the struggle that's going on, and we really want to, our whole team is a mission to elevate the direct care workforce, and be able to have a professionalized, people view folks that working in HCBS workforce as professionals, and that the people working in them feel like they're professionals themselves, and they can really provide the quality care to the folks that we serve, and hopefully be able to take on more individuals. We know there's a long list of folks who need services, and some agencies aren't really able to take them on because of staffing. And so we're trying to figure out some ways that we can kind of help with that. And skill set is maybe one of those ways we can target.
That's kind of like the overarching goal. And, like Heather said, like you're not necessarily getting, points towards being creative, but we're wanting to give the opportunity to training providers, to HCBS providers, the opportunity to think creatively and maybe have the opportunity to do something where you normally wouldn't be able to. So yeah, I mean, submit your questions and we'll tell you, Andrea
asked about the funding. It's the absolute deadline is 12/31/2023 because ARPA projects end March 31st, 2024. So we have to have some time for processing that. So it doesn't have to be a calendar year or a fiscal year. The hard cutoff for expense dates is 12/31/2023.
Yes. So a little bit over a year. And we have 6 different cycles, you know, so we're really wanting to demonstrate and give as many opportunities as possible. Anything else?
And if you don't have them now, that's fine. Okay, how do you consider a directly related job? So, you know, Allie, I saw a training come by and it was basically like, how can this is just trainings that come in the website. So the question is, do they have to be considered directly related to the job? Can they be, you know, increasing cultural sensitivity, diversity, inclusion? And I think that is very applicable, because how are you going to serve people if you don't know how to serve them in a manner that's meaningful to them? And so that's kind of how I would look at that, is like, if you are experiencing clientele that you haven't had before and you need to figure out how, you know, how best to meet them where they're at and be sensitive, I think that's super important. And that would definitely be something that is considered. I think you just look at that application and you're like, this is how it makes sense, right? And part of that application talks about evaluation. How are you evaluating the effectiveness of your training? And so that would be kind of that part, right? Like, do people feel comfortable? I am sure as providers, you have to provide some sort of survey feedback situation for the folks you serve to kind of see, are you hitting the mark or not? And so like that could be part of that.
Yeah, definitely. I really, if you feel that a training would be valuable to your clients, then definitely put it into the application, you know, or email us and ask specifically like, well, this is how I see it. This is how this would help my, you know, 100 of my clients. And we can provide better service and better quality, and, you know, provide this opportunity for even retention of your staff.
I'm going to go ahead and sneak back a few slides just to leave the dates up here as we kind of finish out, just because I think that's probably super helpful.
Thank you, Brooke. So thoughtful. Are there any other questions? I really appreciate everyone that came. We're, you know, this is why we're doing these informational webinars, because we really want to award clients. That is like the purpose. So so please email us, apply.
There will be more. I can tell you when the next one is.
November.
It's November. I know it's in the morning. As I was trying to make them at different times. Let me, November 14th from 9 to 10 a.m. And we'll get that on the website with the Zoom information. We will have them probably every month. We will also have, when people are awarded, we'll have informational webinars about reporting. So folks, instead of just asking you to take a stab in the dark, we'd really kind of want to help folks kind of understand what we're looking for and how to make that reporting process easy. We would love to build like a community of folks who can kind of rely on each other and help each other out with some questions. So if we would like to do that within our informational webinars, is get people connected to each other. So maybe they can kind of talk through some processes. We definitely want to be open. We know stuff happens. You know, there's things that we have to do on our end, but we want to be as flexible as possible. And we really want to encourage folks to reach out early and often if there are hiccups or concerns. So that allows us some time to like rework things and rethink things through so that it can be effective and efficient. Can we use an existing training program that we started this week for the grant? No, it has to be, nothing can start before the approval date. You have to know that you've been awarded the grant and that part has started before anything would be considered being paid for. Now, if you've already started something and you're like, well, we can do this for a month or two, and it ends, right? And then you're applying for the grant so that it can be more sustainable. You're like, hey, we did this. It was really great. It really helped out. We'd like to be able to continue it for another year. That would make sense.
Mhm.
When you say supplement, do you mean this training program needs to be created new for this grant? So it's really a struggle. So CMS, Center for Medicaid Medicare, I mean, they're real big with the supplement versus supplant. Supplement means if you are already required to provide this training for your staff, then you can apply for this grant to cover it, because that is already technically factored into the rate of what you get. Is they have to have A, B, and C to do this. That's your requirement. It doesn't need to be a new training program. It could be something that you have seen that sounds good, looks good. You've heard from other providers that it has worked fantastic, as long as it's not part of that standard core training that you would have to provide staff anyway. And I would encourage folks to think of training in a pretty broad way as well. Like, what does training really mean? Does it have to be an official training person coming from these credentials to do it? We are going to ask what your training qualifications are of the person you pick, but like, that's where that creativity piece means. In what do you already have folks that do these things? Can they do it even better into a bigger audience if you had more support to do this and expand that program? Again, it's not your core stuff, but it's something more, looking at it that way.
Yeah, there's like required trainings, right? Like all the HR stuff, that you have, that are required. Those are not trainings that would be covered by this grant. But if you have a special training that would enhance the your direct care workers, then that would be considered. Does that make sense, Andrea?
Right. Does anybody need any other links to information or contact information? I'm pretty sure I put our workforce email in there.
Mm-hmm.
So that's always the best thing to reach out to, because one of us will respond with stuff. At least get you pointed in the right direction. And we will have another webinar next month. So bring a friend, and feel free to send us more questions in between.
And that's another thing that we asked too from the direct care workforce, is to really spread the word, right? Like, if you have other providers, if you have a community of providers that aren't aware of the direct care workforce and the work that we're doing, if they're not aware of the ARPA grant opportunities, then please, give them the information, share it, and yeah, hopefully we can spend the next year really building the direct care workforce. I think that's it for the questions. Does anyone have anything else?
Let me look here. I don't see any more in here.
Okay, well, I just want to thank everyone for coming. If you have any other questions, or if you think of something, while you're going for your walk or something, please feel free to email the direct care workforce, and we'd be happy to respond. All right. I think that's it. Brooke, thank you so much. Thank you again, everyone. And we'll definitely